All right, now I'd like to welcome to the show Rachel Barkley, Director of Able Americans, a program of the National Center for Public Policy Research. Welcome to Free the Economy, Rachel.
Thank you, Richard. I'm so glad to be here.
So, when we talk about economic and social policy, we often focus on topics like employment, family formation, and public health. Those are all big ones. Uh, but we don't often talk about them through the lens of disability access. Can you tell us how the Able Americans Project is working on that angle?
Yes, you are totally right that this is often something that we don't focus on when we talk about all those areas you mentioned, which all impact people with disabilities. So, in the US, just to give you some perspective, there are 60 million Americans with some sort of disability. So, whether that's intellectual or physical. So, that's kind of the universe when we say disabilities, we're talking about everything. And then an additional 40 million Americans who are caregivers. So, that's 100 million Americans who are affected by living with a disability. And that touches a lot of different segments of public policy.
And so you mentioned, and you are the author of a great report, Able to Succeed. It's got a lot of excellent information in it. Uh, that so you mentioned that number, the 100 million number, both people directly affected by disability, people who are, at least part-time caregivers. Obviously, it's a huge number. There's only 330 million people in the entire country, so it's a big chunk of them. When you make your policy recommendations, though, do you break that down into sort of smaller subgroups? Because there's people with uh, certain physical conditions, cognitive conditions, and obviously people who have caregivers, people who have might need more care than others. So, is that are the differences between more severe disabilities and less severe ones reflected in the law, or are they reflected in the policy changes that you're recommending?
That is a good question. We don't really segment our recommendations out by different parts of the disability population. Though certainly there are different considerations for different types of disabilities, right? A physical disability need isn't the same as an intellectual disability need. But within every public policy, there are those different pieces. And part of the Able Americans project we have is called Project Access. You can go to myprojectaccess.org, and you have the ability to look at different federal agencies and what they programs and policies provided to different types of disabilities, and you can sort it by that. So certainly the government has different policies for, let's say, a blind individual versus an individual who's a wheelchair user, et cetera.
Hmm. Right. And I guess again, sort of big picture here when it comes to government policies, how much of the problems that you think need to be solved, how much of them have to do with government agencies not doing enough or not having enough resources, and how much of it is government agencies trying to do too much or getting in the way of solutions?
Yeah, I kind of segment the problems into a couple different areas. One, so the history of disability policy and treatment under the law in this country, there's a pretty shady past that hasn't lived up to our American founding promise. So you go to the early 1900s, and there are policies of eugenics that are reflected into state level policies, for example, that allowed, and the Supreme Court upheld this, that allowed forced sterilization of individuals with disabilities. I mean, we can't even imagine that today. It's so reprehensible. But that was upheld by the US Supreme Court, right? So we have this question of equality under the law, where certainly I think there is a role for the federal government to come in and make sure there is equal access, equal opportunity to the pursuit of happiness under the law. I also think that in this kind of Declaration of Independence spirit of this, right to the pursuit of happiness, there is this question of the social safety net's role. And I think most of us can agree that there is a role for a social safety net for people with disabilities where civil society isn't picking up, the healthcare issues, other issues. So I think that this is one population where there is a role for a social safety net. Um, Unfortunately, the federal government isn't doing the best job at getting outcomes through that social safety net. And so I think in that regard, we need to look for outcomes, metrics to make sure that these programs are actually serving people.
Yeah, I mean, I think that's an excellent point where a lot of times the argument is about more funding versus less funding, whereas some of the people I've talked to here on the show, including just recently Scott Winship of AEI, has talked about maybe better funding or smarter programs and smarter administration at any level of funding, whether it's more or less, maybe doing more with what doing smarter administration. What we have is a good idea. And speaking of that, that brings me to a kind of unusual, kind of high profile story that popped up, at least here in DC. The Washington Post has reported for the past like year or two over a series of developments that when it comes to the Social Security Administration's disability program, um, that they have this process where if you apply for supplemental Social Security income because of a disability, they will decide whether they should approve you or not. The question is whether you can be out there doing a job and making your own living or not. And so they have this master index of jobs, sort of all the jobs that you can do. It's sort of like a uh, one of those like educational morning programming. And if there was a job on the list that they thought you could do, that they wouldn't give you your disability income because they could say you should be out doing X, Y, and Z job. But what people noticed over the years is that the list of jobs was laughably out of date. And so there were jobs that had been automated away decades ago. They were telling people they should go out and be like pneumatic tube operators, right? And we haven't had pneumatic tubes in offices in 50 years. Um, and so this became, kind of a scandal. A lot of people were getting their disability claims denied because they were being told they should do a job that hadn't existed for 40 years. And the government bureaucracy here was so sort of sludgy and slow. It was 50 years out of date, which seems like it kind of blows your mind, right? A technology company that was 50 years out of date wouldn't still be in existence. But of course, uh, the federal government never goes away. So, you know, I don't know if there's a solution to that besides the solution that we had in this case, which is someone makes a big deal about it, and then a member of Congress hears about it, and they hold a hearing, and they ask the Social Security Administrator, "What the hell heck is up with your organization?" Um, but have you seen situations like that where it's just like policy is just sort of, even if it was maybe well intentioned to start with, has gotten so out of touch or out of date that it doesn't serve its purpose
Oh,
anymore?
absolutely. I think that story is indicative of most of the programs that serve people with disabilities. And so, yes, I mean that's something that we recommend in the report is updating that list. But you look at Medicaid statute signed in the 60s that still applies today. Um, so just, the history of disability policy, the Americans with Disability Act was signed in 1990, bipartisan, signed by then President H.W. Bush. And that was a huge change culturally. Some people argue about whether it has really helped people with disabilities get in the workforce or not. Regardless, when it comes to civil rights, that was a huge change in how society viewed people with disabilities, the ability, now children with intellectual disabilities are integrated in schools and not put out into
Mm.
their own, separate classrooms or schools often to set them up for integration into society as adults, right? And that is a huge change from what how people with disabilities were viewed. So much has changed. The technology has changed dramatically. So I'm a wheelchair user. I have this wheelchair that won an award a couple years ago for how innovative it was. It's only a 50-pound chair that's motorized. So easy to get in and out of cars, folds up, easy to get on and off of airplanes. You think about wheelchairs in the early 20th century, you think about It's a Wonderful Life and Mr. Potter's big wooden wheelchair. Think about how
Mhm.
much that has changed. And so it used to be that disabilities were viewed as you're going to be homebound, you're never going to work, you're going to be seen as, a dependent, and it's just not that way anymore. But Medicaid statute still sees a lot of it that way, that
Mhm.
it's for
Mhm.
elderly people, people who are homebound or institutionalized, et cetera. And so it hasn't caught up with, well, maybe some of our statutes on what should be covered by Medicare, Medicaid should include these new technologies and not old legacy technologies. And could name probably 10, 15 other things that are stuck in the 60s and 70s.
Right. And it seems like the development of new technology, internet technology, hopefully would have created a lot of work opportunities for people with other physical mobility limitations, right? If the old view of work is either you go work in a factory or, maybe you go downtown and work in an office. If you have limitations that make that much more difficult, there weren't a lot of like home work opportunities for you that you could support a family with. But I mean, with COVID obviously taught all of us, regardless of our level of mobility, we can a lot of us, if we're in that office world, we can work with our laptop on the couch. So, uh, what what kind of progress is there in that direction? It seems like there would be more opportunities focusing up with just the uh, di
Yeah.
digital homework opportunities.
Yeah, the pandemic, people in the disability community said, finally, we have been saying for a long time if employers were able to give this kind of flexibility, and frankly, mothers as well. So I'm a mother as well as a person with a disability. Mothers, people with disabilities have been saying, we can do good productive work if you gave us some flexibility, right? This rigid 9 to 5, be in the office is not very conducive if you have a chronic illness or have other considerations for your health to be in an office for long hours. And then when the pandemic came around and the whole population needed to work from home, and we saw, oh, actually, this is very doable and very productive, actually we saw workforce participation increase for these populations, right? For people with disabilities. And it's unfortunate. I think some big companies are stepping back from that, and the disability community is saying, let's keep this in place because it really opened up opportunities.
Well, yeah, and I've definitely seen a lot of sort of ping-ponging back and forth in stories. I read all these stories about return to office, remote work policies in corporate America, and so you've seen a handful of particularly high-profile companies and CEOs say that they want their executives, their office workers back in the office. Um, but sometimes that there's a headline there that says CEO announces return to the office, but in the seventh or 10th paragraph, it says but they also committed to certain flexibility for people with demonstrated needs or there's so there's been a lot of headline level back to the office stuff, but there's still kind of below the fold, but companies are still building flexibility into it. So it seems to me like we'll have a kind of new equilibrium. Like it's not going to be 2021 anymore, right? Where everyone's at home all the time. And it's not going to be 2019 where there's hardly any flexibility, that there will be a sort of, CEOs kind of want to look like they're like strong leaders. And this seems to be like the thing that like signals strong leadership,
Yeah.
is telling people, get up off the couch. But there seems to be a lot of realism where they're sort of quietly saying, yes, we'll still make accommodations more than we did in the old days.
I hope so because having people with disabilities in the workforce, it is one good for society because we know that working it leads to so many good outcomes in life for anyone. So work being a person who works correlates with better mental health, better family formation, obvious economic impacts. And so there's so many good societal societal goods, I guess, from working and not having people out of the workforce. But then it's also good for business. So as I was writing my paper, I thought, what do we know about this? And there was a recent 2023 report from Accenture, that is, kind of like a business consulting firm that found companies that lead in disability hiring saw 1.6 times more revenue, 2.6 times more net income, and 2 times more economic profit. So it is good for companies too to hire people with disabilities.
And one element of this, like a lot of this is about sort of economics and employment, and obviously making sure people are kind of economically secure and giving people disabilities as much opportunity as possible to sort of, have a career and work like you're pointing out. But I think one element that I see not talked about as much, but that you have talked about is the sort of family formation and parenthood issue. And, the traditional, again, sort of like the conservative talking point is that, work is good and work is valuable, but of course, family is good and family is valuable too, even more importantly. And we often think of people with disabilities as needing caretakers themselves, but obviously millions of Americans have kids, and they're taking care of those kids, and sometimes they're taking care of older parents who maybe have some disabilities of their own, all at the same time. And and as we have this sort of broader, more mainstream idea of about people with disabilities is all of us, not as this sort of one little narrow segmented, or like institutionalized part of the population. Talk about how important it is not just to let people have a career, but to like make it an understanding that people with disabilities will get married, they will have kids, they will have all of those family experiences as well.
Yes. And I also want to make sure I hit on something that I bring up in every interview because it's important to say that any of us could become part of the disability population at any moment.
Mhm.
Tomorrow, you could become a part of the population. And if it's not you, which most people at some point in their lives, even if it's a temporary disability, have a disability at some point in their lifespan. Um, if it's not you, then it's one of your family members, right? A parent, as you said, or a child. And so this really, everybody should care about this because it will affect them somehow someday. Um, so for marriage and family formation, one, we know that when you talk about the caregiver side of things, that the pressures that this puts on families are just immense. And we see a lot, unfortunately, the data shows a lot of divorces come from this, a lot of because a lot of financial strain happens because these healthcare programs are complicated. The social safety net is very complicated to navigate. And it unfortunately keeps people in a survival state rather than a thriving state.
Mhm.
And a lot of that has to do with asset and income limitations. And so, even barriers to getting married, often people with disabilities are on SSI or Medicaid. And if they marry someone with an income that makes them ineligible for Medicaid or SSI, that becomes a big challenge. Do you get married or do you lose your caretaker that's provided by Medicaid? And people can't live without that, right? You can't live without healthcare. And so they just forego marriage because they can't take on that burden.
Well, yeah, and so this is a something that comes up in other areas in social welfare policy, what we call, benefit cliffs, right? The idea that like once you get to a certain point, if you earn one more dollar of income, then all of the benefits you had behind you are lost. Um,
Yes, and
and
people with disabilities have the largest benefit cliffs. Often that cliff is somewhere in the hundred thousands of dollars range. So you have to go from perhaps a low wage job or no wages to suddenly overcoming $120,000 of income a year to be able to afford your health care in a private setting, afford groceries, housing, all of that in a private setting because you've lost eligibility for all of your programs and fallen off that benefit cliff.
right, and one thing about, like I said, the sort of benefit cliffs in disability policy are sort of mirrored by some of the ones in tax and other social welfare benefits. And there are a lot of parallels here. And one of the things that struck me in sort of big picture about your recommendations is how similar they were to general policy reforms ideas around the country. That is, the goals are better education and job training, better healthcare resources, more housing security, access to reliable transportation. So the things that everyone cares about um, are some of these recommendations are tailored within those categories to people with disabilities. But again, the policy priorities are really national population-wide priorities.
Oh, absolutely. So I work on another just general social welfare reform project called the Alliance for Opportunity. And we work on all of these issues. I would just say when you look at the disability population, they're just the problems are so intensified. And if you'll allow me, I'll tell kind of my personal story with that system. I think it always helps to look at what an individual goes through. And I'm someone who has a very strong social safety net, right? I have a husband, I have parents and in-laws who came around me when I became disabled 5 years ago. Um, so when I was unexpectedly disabled at 30 years old with a newborn baby, I was in a hospital setting for about 4 months. And in that hospital setting, I had a social worker come in and say, all right, when you get out of the hospital, how are we going to help you kind of transition back into life? And so that was occupational therapy, physical therapy, all of those things. But then there was also, and do you want to work? Do you not want to work? What does that look like? And here's the stack of paperwork you have to go through if you decide you don't want to work and want to get some benefits to help you live. And so it drops this whole huge stack of papers of all the different agencies I'd have to apply through. And mind you, I was a quadriplegic. I could not hold a pencil. And here's this huge stack of paperwork I was given, and I would have to take that to probably six different offices to get my transportation benefit because I couldn't drive anymore as a quadriplegic. I would have to wait for public transportation to show up at my house after filling out the application and setting a time to go to the public transportation office. And then I'd have to wait somewhere hour and a half window where that public transportation may or may not show up. They show up, they take me down to the office, I do an interview, they give me my transportation benefit as a disabled person. I get the bus back, and then I have to wait a couple months to get an interview with an office called vocational rehab that would help me with assistance to get back to work, which is the kind of path I chose with the safety net. Um, but I had to do a phone interview and then I had to do an in-person interview. Again, as a person who now I can't drive, I'm dependent on public transportation, and you see where this is going. And I only
Mhm.
touched two offices. People often have to touch 5 to 7 offices, right, to get their different benefits.
Yeah, and so when it comes to again one of these like opportunities for reform, one thing I think we've actually mentioned before on the show, but that I've also read about is that there are some states do a lot of this. You've got federal policy, and then you've got state policy interacting with each other, and that you have states like Utah, for example, that's decided that they wanted to streamline that as much as possible, and so they're trying to create a sort of one office, one door, sort of system where you don't have to go to 5 to 7 offices and agencies and departments. What does that look like?
Absolutely, yes. This is something I have been working on for a couple of years because Utah is the only state that allows this kind of integration. And it requires integration at the administration side. So, a governor of a state having purview over all the programs and organizing them together, and the administration into kind of one macro office with macro policies, and then for casework, integrate everything. So if you're a social worker and you log onto your computer to go help Richard get his benefits or get back to work, you see everything that you're eligible for, everything that you're on already, all the programs you're on. So are you receiving food stamps? Are you receiving Medicaid, et cetera? Um, your caseworker has a picture of your whole life, and they ask you questions like, what are you experiencing that is keeping you from getting back to work? Is that domestic violence? Is that the inability to get transportation to your job, et cetera? And then helping you problem solve with that, connecting you to a community nonprofit that will help you with that. So they see you as a whole person, but the administrative integration, the data integration, so that the caseworker can see the whole picture of what is available to help you get back on your feet.
Yeah, that seems like a situation that one would take some resources to get set up in the first place, but that other states might benefit from from looking at themselves.
One would think. So there are some federal restrictions to doing this. So the dollars that go toward your workforce are not able to be integrated because of laws in Congress that we would like to change and allow state waivers the freedom and flexibility to do this.
All right. And so speaking of which, speaking of Congress, what are you looking forward to in this new administration? Maybe not just in Congress, but we've got a new president coming in. We've got the 119th Congress, and priorities are no doubt going to switch somewhat from the previous 2 and 4 years. Um, what topics of the things you talk about in the Able to Succeed report and the different policy recommendations you've made? What do you think is in kind of the Overton window of maybe we can get progress sometime soon on these things? Maybe some other stuff will take a little more time, but what are we looking at in the near term?
Yeah, I think big picture, incoming President Trump talks about this golden age of America that he wants to usher in. And, you know, if that happens, that benefits everybody. That benefits people with disabilities. If there are huge technological advances, that helps people with disabilities. If daily costs are driven down, that helps people with disabilities. So I think all of those things are things people with disabilities have to look forward to. Specifically, some things I'm hoping he addresses would be some things in the tax code. So Republicans have said that they are going to take on a big, it's called a reconciliation bill, or it's a tax and budget package this year. And I hope that in that we continue something called ABLE accounts, which are tax-free 529 savings accounts for people with disabilities that help them get over those income and asset limitations that we talked about earlier. So keeping and expanding ABLE accounts would be something in the near term. Additionally, I really am hoping for a number of healthcare changes. So Medicaid is so dependent upon, but so problematic. So many problems for people with disabilities that keep them from moving to a different state because it's dependent on, you got on the wait list in your state. You can't move to another state and start that
Mm-hmm.
process over. So reforms in Medicaid and particularly reforms for mental health and substance abuse disorders. So we have huge shortages of beds in our hospitals and places in our communities, and that is leading to the homelessness problem we see, to problems in our prison system where people with disabilities are in prison rather than getting the mental health care that they need. And it's a problem for our police force that has to shoulder this burden. So I'm really hoping that we can address a few of those issues in Medicaid.
All right, fantastic. Well, it sounds like a big agenda. Um, so Rachel, thank you so much for being with us. This has been an excellent conversation. Before we go, why don't you tell people where they can find all of your excellent and impressive work online?
Thank you so much, Richard. Well, I really appreciate you having me on and being willing to talk about this. I think it's a new frontier, a new pioneer of policy. And so I hope that your listeners can join us in this. You can find us at ableamericans.us. And that website will have all of our op-eds. This policy paper mentioned, the policy paper is called Able to Succeed. And everything is found there.
All right. Thanks again for being with us.
Thank you, Richard.